Good evening, everybody. My name is Dr. Jean Phelps, and I'm the Director of the Office of Student Activities here at York College, and also a member of the Greater Queens chapter of the Links, the two organizations that are bringing to you this phenomenal presentation. I have the pleasure right now of introducing you to the MC for this evening, Dr. Linda Michelle Barron, who is an associate professor in the Department of Education here at York College and also the executive director of the Africana Studies Center and the Resource for Community Research here at York College. Welcome, Dr. Linda Michelle Barron. We may be having a little technical difficulties, but I'm quite sure she'll be on in a second. Okay, as they're working that out, we do thank you ever so much for joining us this evening. Let me reach out to the tech people in the sky. Imran, are you there, Imran?
Yes, I'm right here. She's not in the stream as of yet. We're still working on that. Sorry.
Okay. Again, we are a little sorry here. Bear with us. You'll find that this is worth waiting for. The information that you're going to receive tonight regarding COVID-19 and its impact on the mental health of our children is something that is we need to hear it. We are constantly dealing with the impact of COVID-19 on the mental health of adults. But too often we worry about our children, but we're not sure what to do when this happens. So tonight, you're going to hear and find directly from the experts out there what it is that you're going to need to do regarding dealing with the mental health of your children. So as we're waiting for Dr. Barron from the Teacher Education Department to appear, I am going to move ahead slightly, and she'll be back in a second. Okay, so without further ado, I'd like to introduce the Vice President of Student Affairs and Enrollment Management at York College, who's going to bring the official welcome to you on behalf of York College. We'll hear more about the vice president later. She's new to York. She's been here with us a short time, but what she's already done is phenomenal. Phenomenal. She comes to us with a world of experience, over 20-something years within the higher education field. She has been working at York College, like I said, for a short time, but she has already shown us what she can do, moving our division along, of which I am a part of that division. So I am going to be pleased and happy right now to introduce the next person who's going to bring you the welcome, the official welcome to this event from York College, and that is Dr. Williams. Dr. Karen Williams is here to welcome you. Thank you.
Thank you so much, Dr. Phelps. Good evening, everyone. I bring you greetings on behalf of President Berenicia Johnson Eames, students, faculty, and staff at York College. My name is Dr. Karen Williams, and I am the Interim Vice President of Enrollment Management and Student Affairs. York is proud to partner once again with the Greater Queens chapter of the Links Incorporated on this important issue affecting people of color in the United States and throughout the world. Every day, we've focused on some complicated, multidimensional concerns related to COVID-19 and its effects on our physical health and the economy. These were important conversations. As we attempt to transition to a new normal, it is critical that we turn our attention to COVID-19's impact on our mental health, particularly among our children of color. This pandemic has left many of us traumatized. Sometimes, as people of color, Black and Brown people, we embrace the mantra of keeping it moving, even when we've experienced devastating losses. However, as I'm sure the experts will share with us this evening, that some of the effects of the pandemic, like anxiety and depression, are obvious, while others remain to be seen. I assure you, dissertations and all kinds of studies will be written about this period in history. We are so grateful that Dr. Presley and Dr. Perez Stablé, led by Dr. Linda Michelle Barron, will frame our thinking around these issues. When Dr. Jean Phelps shared this program concept with me, I didn't even have to give it a second thought because it had to be done, and I knew it. So I want to thank her publicly for her vision, because your college will be ready to serve as a community partner focused on a culture of care in support of the mental health concerns of our children and young people through our programs and services. As I conclude my welcome, I want to thank you again for joining us for what will be a fascinating conversation. You could have been anywhere, and you've chosen to spend this evening with us, taking care of this important issue, and we truly appreciate it. Before we begin, allow me to please allow me to introduce you to our phenomenal leader representing us in Congress, Congressman Gregory W. Meeks. He's a graduate of Adelphi and Howard University Law School. He worked as a Queens County Assistant District Attorney, a prosecutor for Special Anti-Narcotics Task Force, and a chief administrative judge for New York State's worker compensation system. In 1992, he was elected to the New York State Assembly, where he served until 1998, when he won a special election to represent the 5th Congressional District of New York. Congressman Meeks is now serving in his 12th term and is the chairman of the House Foreign Affairs Committee and the first Black member of Congress to serve as chair of that committee. He is a senior member of the House Financial Services Committee, where he serves as the chairman of the subcommittee on consumer protection and financial institutions, which oversee all financial regulators, such as the FDIC, Federal Reserve, and all matters pertaining to consumer credit and the stability of the banking system. Here in our district, Congressman Meeks is focused on revitalizing the economy, creating jobs, and enhancing the resiliency of the 5th District's transportation, housing, environmental infrastructure, which were all hard hit by Superstorm Sandy. Throughout his tenure in Congress, Congressman Meeks has fought to make New York City accessible and full of opportunity for all New Yorkers. One result of Representative Meeks' tireless effort came to fruition in April 2017 at the groundbreaking ceremony of the crossing at Jamaica Station. The housing and retail project, which will bring approximately 4,000 construction jobs to Jamaica, includes hundreds of new affordable residential units. To make this crucial economic development possible, Congressman Meeks secured $21 million in federal tax credits. Ever striving to improve New York City's accessibility, Congressman Meeks strengthened the major regional transportation hub in Jamaica, Queens, via the intermodal enhancement and Atlantic Avenue extension, which includes parts of the LIRR and New York City subway system, AirTran connection to JFK Airport, which I've been honored to take several times, and a total of 31 bus lines. He secured over $6 million and $10 million through the Federal Transit Administration and Federal Highway Administration, respectively, to vastly improve transportation in this district, especially to and from JFK Airport. And again, I thank you for that. Congressman Meeks also worked with Governor Cuomo to provide a significant $10 billion upgrade to JFK Airport. Ever focused on increasing diversity, Congressman Meeks advocated for minority and women business enterprises in the bidding process. Increasing diversity in all sectors of the economy is important to Congressman Meeks, and in 1999, he secured $250,000 in federal funding to initiate the Science, Engineering, Math, and Aerospace Academy here at York College. The SEMAA program continues to educate and inspire students to this day. Congressman Meeks has also been instrumental in building up Far Rockaway, collaborating on the Monumental Roadmap for Action, introduced in 2016, which will provide $91 million for the revitalization of downtown Far Rockaway and increase affordable housing options, improve transportation infrastructure, and boost the local economy. Finally, I will share that in the spring of 2017, Congressman Meeks and New York City launched a new ferry service, New York City Ferry in the Rockaways, a month ahead of schedule. This critical project has been in the works since 2005, where Representative Meeks procured $15 million in federal funding. Personally, Congressman Meeks is a faithful member of Allen AME Church in St. Albans and a proud member of Phi Alpha Fraternity Incorporated, 0608. As a huge sports fan, Congressman Meeks enjoys watching the New York Knicks, the New York Giants, the New York Mets, and soon the Queensboro FC soccer team in the brand new stadium opening on York College's campus in 2022. Congressman Meeks is married to the lovely Miss Simone Marie Meeks and has 3 daughters. He's done a couple of things. So at this point, I'd like to turn it over to Congressman Meeks with thanks for joining us again this evening at York College. Congressman Meeks.
Thank you, Dr. Williams, for that introduction. I need to take you on the road with me. You know, as soon as it came in, I see the sun coming in, so excuse the shadows that are in my face. I don't want to get up to close the blinds. But I'm delighted to be here, and I want to thank you, Dr. Williams, again, for being the vice president, of York College, and coming and doing a fantastic job, along with our illustrious president, Dr. Ings, who has really made York College the center of Southeastern Queens and an integral part. When you think about York College, all that we've been through, especially through the last year with COVID-19, whether it was testing, just went to Dr. Ings and York College, says, can we do testing at the campus? Done. Now vaccinations, can we do vaccination at the campus? Done. Can we get a stadium, working in a public-private partnership at the campus? Done. Trying to make sure that we have communications, like now today with the great speakers that we're going to have later, dealing with minority health and particularly dealing with the mental health of our youth and our young during this, our children during this pandemic. Done. So now she has the great teammate, also Dr. Phelps, Dr. Jean Phelps, who is the ultimate community person, who always thinks community first. And she putting on this program and helping. She's one that will be consistent and persistent to make sure she gets the things done for our community. And we appreciate her so much, Dr. Phelps, for all that you do. And let me now also give a special thank you to Dr. Durandis Presley and Dr. Perez Stable for being here today and taking time out of your schedule to talk to the community here in Southeastern Queens in general, and all of those that may be jumping aboard. I will be brief because you're going to get this dynamite information from these 2 fantastic health professionals, which is significant for all of us. Let me just run a couple of things past you real quick. I'm sure you've all heard a couple of weeks ago that the CDC and the FDA announced a recommendation to pause the Johnson & Johnson vaccinations as they researched a new side effect related to blood clots. First, let me urge everyone to get vaccinated, because we need to get past so we can get to herd immunity and get back to a normal state of living and activity, etc. So we need to get everybody vaccinated. But I just wanted to make sure real quickly that I tried to clear up some questions that people may have had. Although at your college right now, it's the Pfizer vaccine that they're distributing, but we want to make sure that you are vaccinated no matter which vaccine is available. Wherever you can get it, we want you to get it. We want you to know that, for example, with the Johnson & Johnson vaccinations, this was not a mandate to stop administering the vaccine. That wasn't the case. Rather, it was a recommendation to allow the time for the CDC and the FDA officials to update fact sheets on potential side effects and allow doctors and patients to discuss the appropriate risks and benefits of the vaccine on an individual basis so that every patient can make informed decisions. They're really on it. And you should know that the individuals with these side effects that we talked about, it was 14 out of 8 million. 14 people out of 8 million that had been vaccinated with the Johnson & Johnson vaccine. So clearly, the good far outweighed the potential of negative side effects. So the CDC and the FDA has now lifted this recommendation and allowed for further use of the Johnson & Johnson vaccine. And the mayor of the city of New York has started utilizing it again. So this is, again, it is very, very rare. The rates of the side effects, you are less than you would have in winning the lotto, to be quite honest with you. You have better chance of getting the lotto, winning the lotto, than of this side effect affecting you. I want to make sure everybody knows that vaccines are safe, and the CDC and the FDA both are still enthusiastically stressing that the best way, the very best way to combat the pandemic is to become vaccinated. I made sure that I got vaccinated as soon as I had the opportunity, as well as my family, as soon as they became eligible. And now everybody is eligible. We want children from 16 and up to get vaccinated. So it is really important. So we have hundreds of millions of instances in real world data to prove that the vaccines are helping to decrease cases and deaths due to COVID-19. And as you all very well know, Black and brown people have been disproportionately affected by COVID-19. And this is due to the social economic factors prior to the pandemic. So we want to make sure that we're healthy, that we're eating healthy, that we have exercise and activity. That is what is tremendously important. So one of our biggest priorities for myself and my colleagues down in Washington, D.C., was to get COVID-19 relief for families across the country, for COVID-19 vaccinations and testing, for schools and more. And we were able to get the relief and help give the state the boost it needs to prioritize testing and vaccinations in the hardest hit communities. That's why you see it at your college, at the Aqueduct Racetrack, in Far Rockaway, in many pop-up places, and particularly in areas which are predominantly Black and brown. So I want you to know the work does not stop. We're getting close to the end, but the work does not stop. We have more testing and more vaccines available for our community now. Then we need to tell everyone to tell our friends and our parents and our grandparents and our neighbors to get vaccinated so that we can see our loved ones safely again. So I urge you to find out the next steps. All you have to do tomorrow night, 9 o'clock, listen to the State of the Union when President Joe Biden will be talking. Your congressman will be there, but I want you to listen, and it gives you the next steps about the investment in our community, transportation and infrastructure, but human infrastructure, especially dealing with the health care so that we can reduce and eliminate health disparities. So I'll stop there and bring on and hope to listen to, and I want you to enjoy our experts will be making a presentation to you today. And I'm telling you right now, it is dynamic, this presentation, but more important than being dynamic, it's life-saving and makes a difference for our children, particularly in dealing with mental health. So again, I want to thank Dr. Durandis Presley and Dr. Perez Stable for being here, and for York College for being all that we can expect and need in our community. Thank you. It's going to be a dynamite event with some dynamite information. Please share it with your friends and families. Thank you very much.
Oh, thank you, thank you, thank you, our Congressman Gregory Meeks, our family, our support system. We love you. We thank you for being here today, but we thank you for all of what you've done and in support of us as a college, as an institution, as people you show in every way you care about. Thank you so much. Well, I have the honor of actually introducing someone I call even a sister, the president of the Greater Queens chapter of the Links, Mrs. Paula Brown Edmay. Please welcome her as she gives you greetings.
Thank you so much. Thank you very much, Dr. Barron. Good evening. On behalf of the members of Greater Queens chapter of the Links Incorporated, I extend greetings to everyone who has joined us this evening for this very important program that addresses and brings our attention to COVID-19 and the impact on the mental health of our children. We as adults all know the mental impact this past year of fear, illness and death, isolation, inactivity, and the lack of interaction with our family and friends has taken upon us. The world and society as our children have known it, attending school, participating in school and after school arts and athletic activities, and socially interactive programs and events, birthday parties, graduations, family reunions, became non-existent. They have functioned and lived their lives educationally, physically, mentally, and emotionally in a bubble with their immediate family and limited friends. Today, we're faced with helping our children recover, rebuilding their lives beyond the remote existence of this past year. Greater Queens chapter of the Links Incorporated is committed to increasing awareness of mental health throughout Queens and the eastern area of our organization. Powerful collaborators like our program this evening with our long-term partner, York College, increases the opportunity for people of African descent and all people to find culturally competent mental health providers. We hope our program this evening will provide you with much needed information and address the challenges that sometimes make it difficult for members and community to learn and access valuable information about mental health care for our families and children. Our Services to Youth facet strategically encourages and works with organizations and provides and seeks to eradicate the barriers to receiving care. I'm grateful for their initiative and the outstanding work and information that will be shared by Dr. Durandis Presley, Dr. Perez Stable, and has been shared with us by Congressman Meeks. Thank you to my co-host this evening, our valued partner, York College, under the dynamic leadership of President Johnson Eanes, and the faculty who have joined us this evening, Dr. Karen Williams and Dr. Linda Michelle Barron. And a special thank you to my sister links, Dr. Jean Phelps, Sheila Beverly Skinner, and Pia Alexander Harris, for facilitating this evening's program. Good evening, everyone.
And thank you sincerely for your sponsorship as president of the Greater chapter of the Greater Queens chapter of the Links. Thank you again. You know, we're here today, as you know, because of our deep care for our children, our future. We recognize that the experiences of their childhood impact who they can and will become as adults. We must support their mind, body, and spirit by informing and supporting those who care for them. We have to provide insights and information and, yes, inspiration. We have invited experts today who speak beyond only the facts to the deep cavern of pain and trauma our children must travail. Also, oh my gosh, they are here to empower us with the knowledge to save our children, save ourselves, and ultimately save our country. So, our first special guest today is one that, we are so pleased to be able to introduce to you. She is, as you have heard, and I'm going to say this correctly, I hope, Dr. Marie Carmen Durant de C. Presley. She is a bilingual clinical school psychologist and currently works for the East Ramapo, New York Central School District as a bilingual evaluator and building psychologist. She serves on the leadership team for professional development of the Early Childhood Center. Dr. Presley's leadership in professional service began over 16 years ago when she held various administrative and supervisory roles at the City of New York's Administration for Children's Services, ACS, as well as an internship at Rockland Children's Psychiatric Center. As an adjunct professor at the College of New Rochelle, she taught graduate courses in the area of psychology and counseling. Her growth in service can be attributed to her undergraduate years at St. John's University, which began as a member of Delta Sigma Theta Sorority Incorporated, where she was initiated into the Omicron Alpha chapter. Dr. Presley is currently the president of the Queens Alumni Chapter, a two-time consecutive chapter of the years 2016 to 2017 and 2017 to 2018 recipient under her leadership. Dr. Presley currently resides in Rockland County. She is a proud mother of a large, loving Haitian family, and we are so thankful to have you with us today.
Thank you so much, Dr. Barron, for that wonderful introduction. I am happy to say that I am the immediate past president of the Alumni Chapter and have graciously passed on the baton to my president, Shirelle Gilbert, who I welcome here today. First and foremost, I want to thank everybody for the opportunity to present. Thank you to York College, to Dr. Phelps, to Ms. Beverly Skinner, to you, Dr. Barron, and all the administrators at York College. A special thank you to Congressman Meeks for all that you do within our community. A special thank you to the Greater Queens chapter of the Links Incorporated under the president, Paula Brown Edmay. So I want to thank you all for this opportunity, and I want to thank my co-presenter, Dr. Perez Stable, as we work in partnership to bring notice and awareness about what the effects of this pandemic is doing to our community and children in our community. So I am going to share my presentation, and with technology, we are going to brace ourselves, and we are going to see what happens. Okay. Okay. I just want to make sure that we are all able to see the screen. Let's see. Okay, we're going to try the screen sharing again. Please forgive us as we work through navigating this technology. Okay, if we can have someone on the technology end, please assist with coming in through the back end to assist with pushing out the presentation. I'm hoping you all can see this screen in full mode. Were you on the back end, were you able to see the slides?
Okay, you're able to see the slides?
Okay, we'll go with you, Dr. Perez Table. So if we can switch presenter mode, we are just going to navigate with technology, and we are going to pivot as we have done through COVID-19. So Dr. Perez Table, your slides are up, so hit it.
All right, I'm on. All right, thank you. I was just making sure I unmuted myself. I saw my slides coming up. I wasn't expecting. So thank you for allowing me to present now. I'm sure that you will advance the slides, so they need to go. If you want to put them into a full presentation mode, that would be good. If not, I'll work like this. So I'm Elise Perez Estable. I'm the director of the National Institute on Minority Health and Health Disparities at the National Institutes of Health. And over the past 14 months, we've been just focused 24/7 on the pandemic. I think that there is reason to be somewhat optimistic about the way things are looking today, but obviously it has been painful and a lot of loss to get here, and we're not out of the woods yet. Next slide. A snapshot on sort of where we are with the pandemic. Everyone's aware of all the numbers. We've become somewhat numb to them, but it's still sobering to see, as of this morning, 577,000 deaths in the US, a case fatality ratio of 1.8%. Just to compare, a bad flu epidemic year is about 0.1%. So this is 20 times worse, of course, also much more infectious. Some data from New York or from earlier in the pandemic, really to compare and contrast what happened in Bronx and what happened in Manhattan. And you can see that the structural inequities really contribute to this. Everyone's familiar now with this image of the coronavirus. It's a single-stranded RNA virus, and these spike proteins that stick out of the virus, the images, just like what you see, really facilitate breaking into human cells through different receptors in a variety of tissues, including the lining of the lung, as well as the gastrointestinal tract, the neurological system, It just really infects a broad part of the body. Next slide. I know that the other presentation is going to be much more focused on the mental health effects, but this is just one example of the effect on children and how we can protect them during this pandemic. And this is based on a survey, a paper that was published just earlier this year. So it does not appear that the kids are better, right? The black bar here shows, are there fewer temper tantrums, fights with kids, arguments with adults, being spiteful or disobedient. But most of the children are actually about the same. And what the factor that contributes to keeping this the same, although you do see temper tantrums are increased for a good number, is supportive home environment and supervision and parenting. And so this really does make a difference. Next slide. Yes, and there is an issue about the pandemic's effects on our communities. And three things to know. Consistently, the data, the initial indicators from March of 2020 have not changed. We're among the hardest hit by COVID-19 in this country. We're at greatest risk for being infected. And because of barriers to healthcare or some selected comorbidity conditions, the worst cases of COVID in our communities, both African Americans and Latinos, where we have the most data, although also indicators that American Indian and Pacific Islanders as well. So it's people like us, though, we're included in the vaccine studies. Next slide. And I want to make sure that everyone's aware that this is a graphic presentation of what has happened with deaths. This is from the CDC from just a couple of weeks ago. And the explanation of this graphic is if you're above the line, that means you have more deaths by these age groups. And you can't see the detail here, but this goes from the youngest here to the oldest here, then your representation in the population. So these are Latino population. You can see the much higher above the bar. Here you see the African-American population, same thing. More disproportionate deaths than represented in the population. And although the absolute number of whites who have died is the largest, they proportionally are less represented based on their representation in the population. The other groups is harder to visualize, but you can see for American Indians it's higher, and for Pacific Islanders, who are a small population as well. Next slide. This is emergency department visits for COVID-19. It's drawn from 13 states over the period of October to December, so just at the beginning of the winter surge. And again, you see this incredible disparity. If we look at a reference point for white Americans, or for that matter, Asian Americans, and Pacific Islanders were lumped in there, that people who are Black or African American, Latino, Latinas, and American Indian Alaska Native are much more likely to have gone to an emergency department for COVID. Now, when do people go to an emergency department? As a physician, I can say, well, they go because they're really sick and they have nowhere else to go, and they've waited until they got really sick to get there. A second possibility is that they had no primary care and they tried to just figure it out on their own. They had no one to call, no one to check in with or visit. And so they come to the emergency room in more advanced condition of COVID. And that's one of the major explanations we see higher rates of hospitalizations and higher death rate for these populations. Next slide. It is important that everyone hears and understands the message that the reason why the risk is greater is structural. It's about social determinants of health. This is not about a racial predisposition to being infected or genetics. We haven't found any of that. People have looked at that as possible mechanisms, but there is no evidence that that's the case. And there was no prior evidence from flu epidemics that we would see this disproportionate burden happen with Black and brown people. But clearly it's because people are more crowded and living more crowded situation, in either dense urban environments, no single family homes with yards or fewer of those. In many communities, it's multiple generations, 2-3 generations living in one household, or two families sharing a household because of economic situation. And then the other big factor is the job market. A much greater proportion of Latinos and African Americans are in service industry, public facing jobs, transportation, construction. They don't have the privilege our communities often don't have the privilege to telework, to do their job from home, like I do, and like many of us do. And so I think this is the biggest reason why we see this disproportionate burden. And once one person gets infected and they bring it home, the household is just likelihood to be infected. There's very hard to self-isolate when people are living crowded in an apartment or in a household. Next slide. So we responded at NIH launching the Community Engagement Alliance SEAL against COVID-19 disparities. This was an effort really that grew out of the crisis of needing to have diversity in the clinical studies, the vaccine clinical studies. Dr. Gary Gibbons, the director of National Heart, Lung, Blood Institute, and I co-chair this effort, but we would not have been able to do it with the really generous support of Dr. Francis Collins, our director, Dr. Tony Fauci from the National Institute on Allergy and Infectious Disease, and other institutes and centers at NIH. I want to point out the website here, which is magnificent. It has English and Spanish resources and a lot of information, not just about our programs, but about COVID-19 studies and epidemiology in general. Next slide. So our goal with the SEAL effort was to address issues of misinformation. I was astounded and continue to be at the level of misinformation that really exists about the virus and the vaccine in all communities, really, but disproportionately affecting the African American community and to a somewhat lesser extent, the Latino community. People get their information through social media. People get their information through a variety of sources, but it's not based on science. And I think the scientists needed to step up and retake control of this information, or at least put our information out there to build the trust in science through trusted voices and trusted messengers. And our motto is to move at the speed of trust. This is not just me as a government employed scientist and physician, or Dr. Gibbons, who's the same way, but also the local leaders, the local doctors, the most trusted individuals to counsel persons often is your local physician or nurse or pharmacist, people that you relate to, people that are in your neighborhood, people that know your community, and really leveraging this through our research network and community leadership. We've been able to stand up our SEAL initiative in 11 states, focusing on both the importance of awareness of COVID-19, the potential benefit of treatments and approaches to control, behavioral, as well as the vaccine prevention, really emphasizing from the beginning partnership between the researchers in science and community leadership. And that's been our modus operandi. That's how we've operated the entire program from the beginning. And I believe that we have had a fair amount of success, at least in getting traction on this topic. Initially, we were very focused on diversity in the vaccine trials, and I'll show you those results. But now we're really shifting it to vaccine uptake and hopefully also enrollment and participation in therapeutic trials as they become available. We will have 10 additional SEAL sites that will be announced, funded very soon. The current ones are primarily in the Southeast, but does include the state of Michigan and California and Arizona. Next slide, please. This is some of the myths that we deal with. I hear this every day. We address this every day. No, you cannot get COVID from the vaccine. We need to be categorical and simple message and direct about this. No, it does not make people infertile, does not cause harm to pregnant women based on the experience, nor does it lead to infertility in women or men. And no, they do not inject a microchip in you to monitor your whereabouts, or as I heard earlier today, to find out where you are. So if you're undocumented, they can deport you. This will not happen. And this is not feasible scientifically, but it is something that has been spread around, and we need to directly address that. The other one is that we're getting injected some material, some genetic material, and it changes your DNA. And the simple beauty of this vaccine as a protein that carries a message to manufacture antibodies against the COVID-19 is really a product of much research. Next slide. Over the course of many years. But we're dealing with a struggle, which is resistance about people not wanting to be vaccinated. We know it's voluntary. People have to understand the importance. And we've been able to achieve that in childhood immunizations in this country. 95% of all children of all colors are receiving their basic measles, mumps, rubella, and tetanus, diphtheria, toxoid vaccines of childhood, of early childhood. And we should be aiming for that level of immunization among our adults. And yet we see in this slide the decrease in hesitancy that we've seen in the African American community. Some concern about the Latino community going up, but it's hanging out around the 30%, 25, 30%. And if that's the resistance to getting vaccinated, it's not the end of the world, but it would be a lot better if we could get this all the way down. And we continue to work on this and make it easier for people to get vaccinated. Next slide. So the studies of this messenger RNA vaccine really, as I mentioned earlier, was a result of long years of basic science research, at least the past 10 years, in response to other epidemics, viral epidemics that took place. Very diverse scientists were involved in this at the Vaccine Research Center at NIH. And as soon as the genetic sequence of the virus was available in January, scientists got to work on developing this vaccine. So it wasn't developed in 6 months and tested and then out in a year. It was really a lot of years, at least 10 years of effort that went into the background research of this. So the community understands this was not a fast development of something. It was really a scientific breakthrough at a level that is really extraordinary, and that we should really be proud of our scientists having been able to achieve this. Both the Pfizer and Moderna vaccines use the same platform. They're equivalent in efficacy and safety. Of the 70,000 or so randomized participants in the studies, about 10% were African Americans, maybe 11 or 12% at most. Between 10 to 20% were US-born Latinos or Latinas. About 5% were Asian, and the rest were whites. There were very few American Indians or other ethnicities, Pacific Islanders in those studies. Vaccines were designed to prevent clinical illness. So we did not design, the trials were not designed with the idea of, are we going to prevent infection? We designed to prevent people from getting sick. And the efficacy was 90, 95%. Deaths were almost virtually eliminated. But we don't know yet whether someone can get infected, have no symptoms, and transmit the virus to another person. That's something that to be determined now with follow-up data. It appears to happen infrequently, the infection, and the transmission is still not determined. And will this vaccine actually be durable? We don't know. We expect it to be at least 6 months, maybe a year, but it's likely that we'll have to have boosters. Next slide. So in summary, our SEAL program, you can see here the states that are covered. Most of the new grants I can share, not the locations, but in general area will be from the Midwest to the Northeast, and include more regional urban settings than initially these statewide coalitions that really start with academic partners, full partnership with community-based organizations, involving the community clinics and clinicians. All the faith-based organizations are invited, the national organizations of physicians and other healthcare professionals, state and local agencies, and of course, our pharmacy networks. Next slide. So what do we need to do to the next step to get this vaccine under control? It's vaccinate, 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 get as many people vaccinated as we possibly can, help people get vaccinated by removing any structural barriers. Vaccine supply is there, and now it's a matter of organizing ourselves to get appointments. Children will probably start getting vaccinated at the latest in the fall. 12 to 15-year-olds may start sooner, but I think in the fall we're likely to see definitely all high school students be eligible for vaccine. The return to school in person can be accomplished and accomplished safely. We feel fairly confident about that. We've made a number of grant awards to try and study that and facilitate that in different settings. That, of course, will vary by jurisdiction, by state, by city. Keeping your mask on indoors, especially when you're around people you don't know. If you're in your home with people you live with, you don't need a mask. But any other situation, you should always have a mask covering your nose and your mouth completely. That is effective at preventing infection and transmission. And so it is not perfect, but it does reduce the likelihood. And some have estimated if we had all used masks from the beginning, the burden of this pandemic would have been reduced by about half. Keep the hands washed. That's the most important hygiene that we do. And then keep some physical distance. I would also recommend that we keep testing. The testing, even if you're vaccinated, testing even if you had COVID, testing if you think you're not going to be infected or you're not traveling or doing anything at risk, because that's the only way we'll know what the activity of the virus is in a community and whether there might be new outbreaks with new variants that we'll need to define early in order to isolate that area in order to really eliminate this pandemic. We are not at that stage yet of thinking in those terms. The case rates have dropped. We're now averaging about 45,000 per day. We hope that keeps going down. When we get down below 10,000, we can start talking about this contact tracing and really figuring out where transmission is occurring so we can implement those proven public health tools. Next slide. I think that's the last one. So this creating a community of practice, staying connected, staying informed, and relying on science to provide the information, including all of your healthcare professionals as well as academics and community leaders that are really stepping up to the plate for all of our communities with appropriate information in response to this pandemic. Thank you very much. There might be one more slide, but we can end this show. Yeah. Oh, yes, important. All the sources that you can visit, and hopefully all these slides will be available to everyone that you can see. Not only these are NIH and other government sources on trials and public health information from the CDC, and the testing program that is funded by NIH in 33 states and the District of Columbia and Puerto Rico to address the pandemic in underserved and vulnerable populations. Thank you very much for your attention.
Oh, yes. Good afternoon. Good evening, everyone. We are so happy that you are here. It is fantastic. We will thank you so much, Dr. I'm going to try to say it correctly, phonetically. I want to make sure I'm saying it. Elise Perez Estable. I think that's right. Oh my God, your presentation was so incredibly fantastic. You gave us such information that we need to have and that the community needs to have about the vaccination and how they need to have themselves and their children vaccinated, and just absolutely wonderful, and the absolute resources that you provide. And we're so excited and hopeful of working with you in the future and with your department and doing great things in the community. Just absolutely wonderful. And now we should be able to have Dr. Marie Carmel Durandis Presley have her presentation. And so, yay, thank you.
Okay. Good evening again, everyone. My name is Dr. Marie Carmel Durandis Presley, and I am excited to be with you all this evening. If we can pull up the slides, please. We are going to be talking about the impact of COVID-19 on the mental health of children. As we are waiting for those who are able to do so, if you see the chat box, if you can just tag in the ages of your children and how many children that you have, if you have availability to do that in the chat, just to get a pulse check on how many parents we have with us today, how many educators we have with us today. So we're going to do a quick pulse check and see that while we are waiting for the slides to be pulled up. Okay, wonderful. If we can just put that in slide mode, if you will. Okay, we will just commence if we're unable to get that into slide viewed mode, and we will troubleshoot and see if we'll be able to play that video. If not, we will just press forward and continue on. Next slide, please. So let's talk about mental health and what that actually looks like in our children in the United States today. So according to the CDC, children are more likely to suffer from disorders such as ADHD, stress, behavioral problems, anxiety, and in depression. What we have found in the United States is that 60.1 million children between the ages of 2 and 17 have been diagnosed with ADHD. We also see that 4.4 million children between the ages of 3 and 17 have been diagnosed with anxiety. 1.9 million children between the ages of 3 and 17 have been diagnosed with depression. One out of every six children between the ages of 2 and 8 have a diagnosis of either a mental, behavioral, or a developmental disorder. The prevalence of depression we see and the prevalence of anxiety, it increases with age. So this is a lot of children that we are seeing in the United States that are being impacted on mental health, which is very important that we take a grasp on this, because little people, little problems, when they're not addressed or catered to, they become big people with big problems. Next slide, please. So now we are going to look at the prevalence of mental health on children. And I know the slide deck is very small, so I'm just going to walk you all through it. For the first three columns, we are looking at depression. We are looking at mental health of depression. So with ages 3 to 5, we see that it is very small. We see it's at the lower level. Then it increases when they get 6 to 11 years of age. And then we see approximately 6% of the population have depression when they turn between the ages of 12 and 17. So as you can see, the trajectory, it begins to grow as children get older. When we look at anxiety, from ages 3 to 5, we see it teetering around 1%. Then as they increase to the ages of 6 to 11 years old, we see that increases to 6.5%. And as time progresses and they become 12 to 17 years old, we see that that reaches 11% of the population. Again, we see that with depression and anxiety, as time increases, we see more children developing these mental health disorders. Looking at the last three columns, where we talk about behavioral disorders, When we look at the first column for children ages 3 to 5, we see that that impacts approximately 3.5% of the population. As they get older, between ages 6 to 11, we see that that increases to 8.5% of the population. And then we see a decrease from ages 12 to 17. We see that that decreases to approximately 6.5 to 7%, and we're going to talk about that. It is important to note that with behavioral disorders, we see that this decreases as children become older. And the reason why we see a decrease in these behavioral disorders is because children, as they get older, they develop language. So instead of acting out their behaviors or acting out the way that they feel, they have the ability to be able to use their verbiage to communicate how it is that they are feeling. So if we can go to the next slide, please. And if we can click on that, we have a quick YouTube video that we are going to see. And if you can share your sound. Okay, so we are unable to hear the sound at this time. So we're just going to pause the video. We're going to stop the video. And I'm just going to give a little bit of background information. So in this video, we have two mothers, everyday mothers, who are being impacted by mental health prevalence of things that are happening in the day-to-day functioning and the day-to-day lives of their children. This first mother, her son has been going through the COVID-19 pandemic, and he has been isolated. He has been going to school at home, and she has begun to see patterns of anxiety in her son. One thing of importance that she wanted to note is that he was out having a social distance play date. Everyone was wearing masks, and she saw a look of terror in his eyes, and she immediately stopped and went over to her son to say, "What is it? What's happening?" to give him a hug. And his heart, she felt his heart beating through his chest and really rapidly beating. And she said, "You know, what is happening? What's going on? Why are you feeling this way?" And he said, "I had a terrible thought that ran through my mind." So we see how it could be impacting our children on regular day-to-day functioning, where they are playing with their friends. They can be drawing a picture. They can be doing specific things. And then instantaneously, they have this thought, which is anxiety provoking and impacting their day-to-day function. So we're going to go to the next slide. We are going to talk about facts and trends that we have been seeing in the US and in our school system. So we have approximately 168 million children that have been out of school due to the school closures. And just keep in mind, remember what we talked about in terms of mental health prevalence, where we have 4.4 million children who are diagnosed with anxiety. We have 1.9 children who are diagnosed with depression. And we have 6.1 million children who are diagnosed with ADHD. So all of those children are lumped in as well into this 168 million children that have been out of school due to school closure, which has many implications. 214 million have missed more than 3/4 of in-person learning this year. And approximately 54 million of those children are in the United States. So this pandemic, we initially thought it was going to be 2 weeks. We were going to get over it. And here we are now in April of 2021, and we are still seeing the impacts, and we are still seeing the ramifications of what has been happening. So our children have missed approximately about more or so a year of school due to this pandemic. We see there is a lack of in-person instruction, which is impacting many factors, such as their socialization. We see that it is impacting their nutrition. We see that it is impacting their academic performance and their stability. Next slide, please. So now this portion is going to allow us to have a deeper understanding of our children and how they have developed. So we are going to look at Piaget's stages of development. And Piaget's stages of development functions over the lifespan of a child into adolescence. So keeping that in mind, remember, when we talk about school-age children, we're talking about approximately from pre-K to the 12th grade, ages 5 through 18, and Piaget addresses children from birth all the way up to the ages of 18. So we are going to talk about stage 1 in Piaget's functioning. First and foremost, we have sensory motor, which is between the ages of 0 and 2. During the sensory motor stage, children learn through reflexes, movements, and they learn through sensations. Then we move on to the next stage, which is stage 2. Stage 2 is the pre-operational stage where children are ages 2 to 7. And during this time, they learn through the use of words, they learn through the use of pictures, they are able to learn when objects are presented to them, and they begin to form their concrete thinking, where they can link objects to a particular thing. If they see a picture of a ball, they're able to say a ball. And at this time, between the ages of 2 to 7, it is important to note that our children are learning to read. We move on to stage 3, which is concrete operational stage. During the concrete operational stage, our children are at ages between 7 to 11. During this time frame, they are learning to think logically, they are learning to think through conversation, and they are beginning to develop their inductive reasoning. This stage is where children are reading to learn. So the stage prior that we talked about, ages 2 to 7, is where they are learning to read. They are having phonemic awareness. They are learning how to decode. And then we come to the stage of concrete operational 7 through 11, where they are reading to learn, where they are using comprehension, where they are using that inductive reasoning to be able to answer questions. So it is important to understand where they are in their specific stages and how they are able to connect with the environment around them. Lastly is this last stage, which is stage 4, which is formal operation, formal operational. Our children are ages 12 and up. This is 12, and they go to 18, where they are going through pre-adolescence and adolescence. They are learning through their abstract thinking. Things are no longer concrete. They're able to formulate opinions on things that are not necessarily in their space. They are able to learn through reasoning, and they are able to learn through hypothetical problems. That's why we see that during this stage, formal operational stage, it is easier to describe the impact of COVID-19 with those that are in the pre-adolescence and adolescent stage, because they have this abstract thinking and they are able to reason with these particular hypothetical problems. Next slide. We're going to continue to talk about theories of development. And the next theory we are going to look at is Maslow's hierarchy of needs. With Maslow's hierarchy of needs, he again begins to track children all the way from birth, all the way when they get through adolescence. So the first stage is self-actualization. With we're going to go down. We're going to build down and go up. So we are going to begin with the red bar. So that is our foundation, and we begin to move up. So first and foremost, the foundational need that children must have is their physiological needs. Children need air, water, food, shelter, sleep, clothing. These are the foundational needs that they need to be able to function and to govern themselves. Next, they need to have safety. They need to feel safe. They need to have a personal sense of security. They need to have resources, make sure that their health care is met. And we have love and belonging, which addresses social emotional factors, their friendships, intimacy, the way that they interconnect with their families, having a sense of belonging to their community, having a sense of belonging to their school environment, having a sense of belonging to their family. Next, we have esteem. Esteem is where they come to a sense and a place of respect, where they begin to build self-esteem, self-actualization, their status recognition, their strength, and their freedom. Lastly is self-actualization. That is where they desire to become the most that they can be. It is what they strive to be, their goal, and how they see themselves as individuals and their goals for themselves in their lives. So what happens when these Piaget stages of development and when Maslow's hierarchy of needs is disrupted? Next slide, please. We are going to see what happens. When these needs are not met, and when children are unable to go through the various stages, and when their needs are not addressed, it causes dysfunction. This is where we see mental health begin to come in. This is where we begin to see children are suffering from anxiety. Children are suffering from depression. We have issues with basic social emotional development. This is due to the fact that their foundational needs were not met. We may see a child acting out. Why are they acting out? Maybe because they are hungry. We see a child that is acting out. Why are they acting out? Because they probably witnessed domestic violence between their mother and their father and something taking place in the home. So what happens when they have these behaviors? If we have young men, we have young women, one thing that we see in research and one thing that we see in trends is that with young women, they have more internalizing disruptive behaviors, and with young men, we see they have more externalizing disruptive behaviors. And when we say internalizing for young women, it's anxiety, it's depression. When we say externalizing behaviors, it's when we see young men being aggressive, or when we see that they have oppositional defiance. So these are things that we mean when we say external and internal behaviors. So let's continue on. Next slide, please. We are going to talk about how COVID-19 has impacted socialization. Due to COVID-19, we see that children are isolated. They are unable to connect with individuals, their community, their outside environment in the way that they used to. There are disruptions, again, in those interpersonal relationships. They don't see their friends. They don't see their teachers. They don't see their aunties, their extended relatives. We see a lack of peer interactions, where there's severe limitations in their play dates. Decreases in self-esteem and self-actualization because they are isolated. They don't have other children to model on. They don't have peer models. They don't have other examples in front of them except ones that are in their homes. And if they have a dysfunctional home, then we see that dysfunctional behaviors begin to increase because that is all that they have been exposed to. We see increases in boredom, increases in acting out behavior, and increases in psychopathology, which is all that we have been talking about in terms of depression, anxiety. So we see those things happening due to the lack of socialization. Next slide, please. So it doesn't end there. As parents, as teachers, as educators, as members of the respective village, because we all know that it takes a village to raise a child, there are things that we can do to ensure that socialization does not negatively impact them, or the lack thereof does not negatively impact them. So certain things that we can do: Zoom play dates, we can use technology, social distance play dates with the increase of vaccinations and wearing masks, hybrid learning opportunities where they go into school for 2 days and they are they go to school for 2 days and they do remote learning for 3 days. Family game nights where they have the opportunity to engage in things that they like with their families, playing Monopoly with your child, or playing Chutes and Ladders with your child. So just different things to do to increase that social aspect. Also, social skill development classes, which can enable them to be able to get these strategies and these techniques that they need. You have to remember that looking at their developmental age, they have lost a year because of this lack of socialization. Next slide. COVID-19 has also impacted nutrition. And as we know, nutrition, the way that we fuel the body, oftentimes impacts the way that the mind functions. The mind needs food and the proper nutrients in order to function. And when the body is not fed, it does cause disruptive behaviors and it does cause disruptive pathology within the body. We can see children not paying attention. We can see children acting out. Again, all because they are hungry. And COVID-19 does impact nutrition. We have a lot of families that have inability to access breakfast and lunch programs because they are not going to school. We see that there are inconsistent eating schedules where children are snacking throughout the day. They're bored. They have nothing else to do but to snack throughout the day. Also, we see children not having access to appropriate foods where it is a lot of fast foods, a lot of junk foods, things that are not appropriately fueling the body. Also, homes with low socioeconomic status, they may have limitations in the home. They may not have food in the home. Therefore, you have a child who is significantly hungry. And another impact that we have seen is the ability to prepare and provide food in a timely manner. We are all Zooming. We are zoomed out. We have Zoom fatigue. We have computer fatigue. We are expected to be everywhere every time because of the access of technology. Usually you have the excuse, I can't make it because it's too far of a drive, or I can't make it because I'm double booked. No longer an excuse. You can log on to 2 devices, 3 devices, and you make yourself accessible. So we see oftentimes that parents have the challenge of being able to prepare food and to provide food in a timely manner because we're also super busy, where we see that COVID shift, where it's that expectation that due to technology, the expectation that we are able to span the world. Next slide, please. And again, there are strategies that we can implement, that we can use to help eradicate what these impacts are. Meal prep. We can make sure that we take a day where we meal prep, where we have nutritious foods in the home, and that we can feed our children in a timely manner. Scheduling family dinners. It is important to sit down and schedule family dinners to have those conversations. Research has shown that children who have dinner with their families at least 2 times a week are significantly higher performers in school academically than those that do not have those family dinners. So if you definitely want to see an increase and a spike in your child, make sure that you are having those family dinners. Why? Because it gives families an opportunity to speak. It gives families an opportunity to check in. The children want to talk about something positive and get that positive praise. So they want to ensure that they have something great to talk about. How are your grades? That's always the first question. How's school going? They want to be able to have something positive to say. Allowing children to plan weekly dinner menus. This gives them a self-esteem. It increases their self-esteem because it shows them that their opinion matters. It shows them that they are actually a productive member of the family, and it shows them they are actually contributing something to the family. Food pantry resources can assist. We know that those who are suffering from low socioeconomic status, you have access to food pantries where you can get access to that healthy, nutritious food that you need. Also connecting with school lunch programs. There are a lot of inner city programs. There are a lot of school programs that ensure that even though there are school closures, families still have the opportunity to get nutritious food through those programs. Next slide, please. We see that there's an impact of COVID-19 on academic performance, and this is self-explanatory. We see low and inconsistent grades. We see that there is a lack of school and classwork. There is disruption in face-to-face instruction. We see that there is a lack of access to technology. A lot of families don't have Wi-Fi. A lot of families don't have laptops. We see families that have 5 children where the 5 children have to share 1 device in the household. We see a lack of instructional support, and we see increases in math and reading gaps. This is extremely important because when we talk about Maslow's hierarchy of needs, and when we talk about Piaget's theory, we see that at a certain age, children are concrete. They need to have those hands-on experiences. They need to be able to have that connection with their teachers, that connection with their friends, and all of these tie in and loop in with those various stages of development. Next slide, please. Now we have many strategies that we can use to increase this academic performance. Make sure that you read to your children daily. It gives them the opportunity to increase their vocabulary, to increase their comprehension. Also, there are virtual library programs where there is a librarian that is reading to them, where they have different members of the community that come in and that are able to read to them, and they are able to access online books. Also, it is important to have your children have access to virtual study halls. Also, it is important to allow them. It is also important to have them have access to virtual study halls and tutoring sessions. It is important that learning is made fun through various daily experiences, such as math lessons at the grocery store, where they are able to do math, where they are able to count various things. If you say, all of our groceries are coming out to $20 and you give them $30, how much change are they supposed to have? So this is important. Also, you can do science experiments through cooking, where they are measuring out liquids and they are measuring out solids to see what these particular things would look like. Also, hotspot donations. There are hotspot donations that could be readily made available through the school and various computer access programs. Next slide, please. Okay, we see that there's an impact of COVID-19 on stability. There is the fear of the unknown. There is not knowing what the new normal is going to be. There is the inability of knowing if a loved one or a child is going to become ill, and also inconsistent schooling and work schedules. We are creatures of habit. Children need to have schedules. Children need to be able to function accordingly in a particular way. And when they don't have this, it impacts them. Next slide. Also, with strategies to improve stability, make sure to follow state laws and guidelines, wear masks, and practice social distancing. Make sure to take a look at what your vaccine options are and how to access it. Have regular check-ins and talks with your children to see how they are doing, to see how they are functioning. When your children ask you questions, be honest when answering those questions with them. Also, remind them that they are loved and that you are always there to support them. And it is important to meet children where they are, especially taking special note to where they are developmentally and where their hierarchy of needs are. Next slide. Okay, so we will close it off to questions. I will turn it over, and I'm not sure if there are any questions, but I will turn it over if we can go to the next slide. This is my contact information. Next slide. My contact information, drdurandis@gmail.com. If you have any questions, just please feel free to reach out and send that out. It has been an absolute pleasure presenting to you all with a full house in my house. And it just goes to show that we are all human and we are all navigating through this pandemic together with our families, with our children. And so we make it happen and we make it work. So thank you so much for the opportunity to present to you all today.
Fantastic. Woohoo! Thank you so much, Dr. Durandis-Presley. That was absolutely fantastic. And so we would like to, as we said, open it up to the audience. If there are any questions at all, please place your questions in the chat and of either of our presenters, of either of the doctors, and they are more than happy to answer your questions. Are there any questions? Oh, thank you, VP Williams. Yes, an absolute fantastic presentation from both of the doctors. Thank you so much. Any question from our parents in the audience? Any questions? Right. So we want to thank you all so much for coming. And so I don't see any questions at this time in the chat. And we want to thank them so much. So at this time, I would like to now turn it over to the president of the Pre-Med Club, Miss Rose. So if we can please highlight her.
Hello, good evening, everyone. My name is Rose Kalu Igwe, and I'm the president of the Pre-Med Club. I'm so excited to be here, and I've learned so much from everyone's presentation, and I want to say a huge thank you to everyone who made this possible from day one. And it's really exciting to be here and being able to get all this knowledge and spread it out to people of New York and maybe even the US is something very powerful, as I believe we all need to come together to make a change in the community, especially with how COVID-19 has impacted each of our lives. I'm just glad that I'm here to gain all this information. So thank you so much.
All right. So we want to just thank our presenters and our speakers so much. We are hopeful that you will join us again. We are definitely hopeful at York College that we may indeed form a partnership with the, that we may form a partnership with Elise Perez in his department with the from the National Institute of Health, as well as with the Greater Queens chapter of the Links. So that is our presentation and our program for this evening. We want to thank you all so much for being here with us. Absolutely fantastic. And if you have any questions, of course, you know, I'm at York College, Sheila Beverly Skinner. You can reach me at any time, as well as Dr. Phelps. We are there every day. I'm also online for the students on a regular basis. And so we thank you so very much for joining us on this evening, and we say good night.